Hello, everyone, and welcome back to Mind in Motion, the podcast where we explore how humans grow, learn, and change across lifespan. I'm your host, Mai Trong, developmental psychologist. Today, we're taking a closer look at a topic that affects millions of families across the United States, aka childhood obesity during middle and late childhood, roughly ages 6 to 11. So, as we move through this episode, you'll notice that childhood obesity isn't just a medical issue, it's deeply connected in children's physical, cognitive, and psychosocial development. So, let's begin by understanding just how significant this issue really is. Number one, is childhood obesity a significant issue? To start, the Centers for Disease Control and Prevention CDC 2023 reports that in about 1 in 5 children ages 6 to 11 in the United States meet criteria for obesity. That's a dramatic increase compared to a few decades ago, and unfortunately, the trend continues upward. Middle childhood is a critical developmental period. Children are becoming more independent, forming their identities, and comparing themselves to peers. Their habits, whether healthy or unhealthy, begin to solidify. Research by Oregon and College's 2020 shows that obesity in childhood significantly increases the likelihood of obesity in adulthood. So, from a lifespan perspective, what happens at age 8 doesn't stay age 8. Instead, it shapes health, self-esteem, and behavior well into adolescence and beyond. Number 2, what evidence supports the problem? Moving forward, let's take a closer look at the consequences of childhood obesity, both physical and psychosocial. Physically, children with obesity face increased risk for insulin resistance, high blood pressure, and orthopedic complications. A review published in the Future of Children by Daniel 2006 highlights that health risks begin early and accumulate over time. Psychology, children may experience lower self-esteem, peer rejection, higher levels of anxiety or depression. The CDC also notes that children with obesity are more likely to be bullied, which can further impact emotional regulation and motivation. Together, these findings show that childhood obesity is a multi-dimensional issue that affects the whole child. Number 3, what causes childhood obesity? So it's a multi-layered issue. Childhood obesity doesn't stem from one single factor. Instead, it emerges from a complex interaction of biological, social, and environmental influences. As Sahu et al. 2015 emphasized, these factors work together across development, shaping both the onset and long-term outcomes of obesity. So we have diet and nutrition. Children today consume more processed foods, sugary drinks, and calorie-dense snacks than previous generations. And then we have physical activity. Many children fall short for the recommended 60 minutes of daily physical activity, often due to increased screen time or limited access to safe outdoor spaces. Next is family systems. Parents influence eating habits, activity levels, and coping strategies. When families face stress or food insecurity, healthy habits become harder to maintain. Peer influence. Peers shape children's food choices, body images, and activity preferences. During middle childhood, peer comparison becomes especially powerful. Then we have socioeconomic status. Lower income families often face barriers such as limited access to fresh foods or safe parks. And finally, we have environmental and policy factors. Brothel vendors, ecological system theory helps us understand how school lunch policies, neighborhood design, and food marketing all influence children's health behaviors. Moving on to number 4, applying the developmental theory. To better understand why middle childhood is such a critical period, let's apply 2 major developmental theories. First, we have Eriksson's industry versus inferiority. According to Eriksson, children ages 6 to 11 are developing a sense of competence, When they succeed in school, sports, or social settings, they build industry. But when they struggle, perhaps because of physical activity feels difficult, they may develop inferiority, which can reduce motivation and participation. Paget's concrete optional stage is the next one. Paget explains that children in this stage think more logically and understand cause and effects. They can grasp health concepts, but they still learn best through concrete experiences. That means hands-on activities like cooking, gardening, or active play are far more effective than abstract lectures about healthy choices. Number 5, how development at ages 6 to 11 influence health behaviors. As we continue, it's important to recognize how development during this stage ranges shapes health behaviors. We have self-esteem. Children begin elevating themselves based on peer comparison, weight-related stigma, and damage self-esteem and reduce motivation. Moving on to peer comparison, kids noted differences in appearance and athletic ability. Peer acceptance become a major driver of behavior. Moving on to motivation. Intrinsic motivation grows when children feel competent. If physical activity feels embarrassing or overwhelming, motivation naturally declines. Coping skills. Children may turn to food for emotional regulation if they lack healthy coping strategies or experience chronic stress. Finally, we have health behaviors. Habits are formed now, like screen time, snacking, activity levels, often persist into adolescence. Number 6, prevention and intervention strategies. Now that we have explored the causes and developmental context, let's shift towards the solutions. Effective strategies must be evidence-based, realistic, and grounded in psychology. We have family level strategies, which is where family meals increase fruit and vegetable intake, and the parents model physical activity, and that boosts kids' activity levels. Or consistent routines around sleep and meals reduce risk. Then we have school programs. Daily recess and high quality physical education both improve health and academic performance. Then nutrition education and healthier school lunches also show measurable benefits. Moving on to the community initiatives. Community can have safety parks at school sports and community gardens that promote activity, or partnerships with local organizations that can reduce food insecurity. Next is policy changes. We can limit junk food marketed to children, improve school lunch standards, and we expand SNAP and WIC benefits. Lastly, we have behavioral interventions. Cognitive behavioral strategies help children build coping skills, set goals, and increase self-efficiency. Each approach has strengths and limitations, but together they create a supportive developmental ecosystem. Number 7, the role of the healthcare system. Finally, let's consider the role of the health professionals, like, for example, pediatrics. They conduct routine screenings, track growth patterns, and provide antibacterial guidance. And we have nutritionists and dietitians. They offer individualized meal planning. They teach practical skills. And we must not forget about the mental health professionals, which address emotional eating, anxiety, depression, or body image concerns, support family dynamics, and help with coping strategies. And lastly, we have the public health system. They implement community-wide programs, collect data to guide policy, and promote equitable access. Together, these professionals form a network that supports a healthier developmental outcome. As we wrap this up, it's clear that childhood obesity is not just a medical issue, it's a developmental one. By understanding the biological, psychological, and environmental factors at play, we can create meaningful, evidence-based solutions that support children's health across the lifespan. Thank you for joining me today on Mind and Motion. I'm Mai Trong. Stay curious, stay compassionate, and keep supporting the healthy development of the children in your life.